Hi guys, good morning. This is Dr. Behnam. Thank you so much for basically joining us on another AMA. Sorry, I had a technical difficulty for a few minutes. So first today we're going to basically every AMA we usually start with talking about a new topic, and today we are going to be talking about our shampoos and conditioners. So here we go. So the Happy Head basically products basically they were made by us, basically by board certified dermatologists. They're all infused with argan oil, biotin, collagen, keratin, and saw palmetto. So typically with the shampoo, I want you guys to use the Happy Head shampoo, thickening shampoo, and apply to the wet hair daily. Leave it on for about 2 to 3 minutes, and then wash it off. And then after that, follow that up with a Happy Head thickening conditioner and leave that on for about 1 to 2 minutes, and then basically you're going to rinse it off thoroughly. The whole point of these shampoos and conditioners is the fact that it was all developed by us, the team at Happy Head, and we took basically all the best products that were out there, and we took all the best ingredients, and we put them basically all into one shampoo and conditioner. So this is a very thick, keratin, biotin infused, thickening shampoos and conditioner. All right, guys. So thank you so much for joining us. So let's go through the questions. So I've been wanting to try your product, but I have some concerns about the possible side effects of Propecia and if they're reversed if the treatment is discontinued. So one of the reasons why we actually originally made Happy Head was because the oral Propecia basically has a risk of sexual side effects. Happy Head is a topical finasteride formula, and based on studies that are available on our website, the topical has a lower risk of sexual side effects compared to the oral. In fact, in my own personal clinic, we have patients who were on the oral Propecia and had sexual side effects, and went on topical and they did not have any side effects. Now, that doesn't mean that side effects do not exist. They do exist. It's just the fact that they're lower by using a topical formulation. Now, if you do have this risk, if you do get the sexual side effects, typically 99.999% of the time, if you were to stop the medication, the side effects will reverse and they will go away. Thank you so much for asking that question. I'm already taking oral spironolactone to stop hair loss. Is it safe for me to use the topical as well? Also, what's the average normal testosterone level for women around my age, 61? So, if you're already taking the oral spironolactone, yeah, it's pretty much safe basically for you to the topical as well. But it also depends on the dosage. So, when you basically submit your consultation, please make sure that you include the dosage of spironolactone you're taking. If you're around the 200, I honestly would not add a topical spironolactone. But if you're around 100 milligrams a day, you could certainly add the topical spironolactone. With respect to the normal testosterone level for women around age 61, honestly, everyone's different. I cannot really answer that. It depends on your history, your demographics. So it's really different. So that's something that you really have to kind of talk to your doctor about that. Um, Will a person who has been on oral finasteride Rogaine experience also vulnerable to initial hair loss? So basically, the question is, if I'm already taking oral finasteride and I'm already doing the Rogaine over the counter, am I going to experience the topical the hair shedding when I start to use the topical minoxidil from Happy Head? The answer is typically no. If you've already been using topical minoxidil, basically the risk of that initial hair shedding is practically minimum. It should not honestly happen. Can the product cause dry lips? That is unusual. It really should not. And we have thousands and thousands of patients on this product, and I'm the one who reviews like a lot of the side effects, and I've yet to see that side effect at all. But anything could happen, but it's unusual. I need a lower percentage of retinoic acid, maybe 0.05. How do I get this done? The 0.01% strength is too strong for me. How do I do this so I don't have to quit Happy Head? Why don't you just send an email to help at Happy Head, and we could definitely get that done. I think we are coming out with a formulation of a lower retinoic acid for like a lot of patients. So just send an email, help at Happy Head, and we'll be more than happy to do that for you. Can Happy Head cause acne on the face? Unusual. I mean, the base is made out of um some alcohol base and also some aloe. So I guess if you were to get the aloe on the face, it could cause some acne, but that's pretty unusual, and I've yet to have someone actually kind of complain about that. But that's unusual. Oral minoxidil, thoughts on that? So I love oral minoxidil. I'm a big fan of it. Oral minoxidil alone by itself, I don't think really works that great. Um, but I have a lot of patients on it, especially given the fact that oral propecia could have sexual side effects. So I'm a fan of oral minoxidil, and we do offer that basically at Happy Head. I also have patients on Happy Head as well as oral minoxidil. So I have those two a combination as well. The most common side of oral minoxidil is headaches, heart palpitations. And if you get any swellings, just basically let us know. Typically, we start with a quarter of a tablet for 2 weeks, then you go to half a tablet for 2 weeks, and then a full tablet. I do recommend buying a blood pressure medication, so you could check your blood pressure at home. Remember, oral minoxidil used to be an oral blood pressure medication for patients that have high blood pressure, so it lowers the blood pressure. Stem cell treatment for hair loss. So I'm a big PRP stem cell fan. We do a lot of PRP and stem cells in our clinic. In fact, I consider myself one of the pioneers of mesenchymal stem cell for hair loss in the US. I started to do it back in 2016, and we do see very good results. So I am a big fan of it. It just has to be done correctly. Typically, stem cells are mixed with PRP and injected, and that could definitely give a boost. And a lot of times when patients do stem cell or PRP in my office, they also continue to use Happy Head as well, and the two work very well synergistically together. Thank you for that question. Can Happy Head help negate any potential thing due to COVID infection? Absolutely. First of all, we do see a lot of hair thinning due to COVID, and I put a lot of patients on Happy Head that have been thinning due to COVID. So definitely there's a plus right there. I've had male pattern baldness for almost 35 years now. Isn't it possible to be too old to get any benefits from your product? Yes, it is possible. It all depends on where you are in the stage of thinning. So if you're thinning, which means that when I look at your scalp, you still have hair, but I could see through the hair and I could see your scalp. That's by definition of what we call thinning, which means you still have a lot of hair there. And by using Happy Head, you could grow some of that hair or even prevent additional hair loss. Um, Balding means that there's just no hair there. So if you're balding, that means you're bald. Unfortunately, Happy Head is not going to help you. I was on a call this morning with a patient who had very large widow's peaks, basically right here, and he wants if you could use Happy Head in his widow's peaks. And I told him, look, there's no hair there, so Happy Head will not help you. Now, if you are thinning in the front, you can certainly use Happy Head and thicken up that area. And again, if there's any questions, you can send us photos. I'll be more than happy to evaluate those photos and get your answer as well. Can I use topical treatments if I have scalp psoriasis towards the front of my scalp? Yes, you could use the topical treatment. Just remember sometimes the minoxidil, which is prescription grade, and also the alcohol base could sometimes cause a little more irritation. Could at times that could make your psoriasis a little bit worse. So that is a possibility. But look, I always say give it a try and see how it works. I definitely do have a lot of patients with very bad dandruff and even psoriasis using Happy Head, and they do very well. So everyone's different, and you're not gonna know until you do it. But you should be fine. Just let us know how it goes. Again, I like to go back and kind of talk about our shampoo and conditioner. So our basically, let me bring this up. So basically, our thickening shampoo is very important because the shampoo has biotin in it, and it also has collagen. So, and I love the fact that it's a biotin collagen shampoo. In our basically clinical research, we also saw that saw palmetto could be very helpful. So we added saw palmetto, and also we added more added keratin to it. And it is going to be available in June. It's a really, it feels really good on the scalp. It's a very good hair thickening shampoo. So I think a lot of our patients are going to like it quite a bit. Also, again, I also want to emphasize that Happy Head is a customizable product for our patients, which means that the product is customized. So let's say if you are using a product and let's say you're getting a little bit too much irritation, we could always go back and change that formula for you. Reduce the minoxidil, reduce the retinoic acid, or even take out the retinoic acid completely, and ship you a new bottle because we want you to be happy. We truly believe that is not a one size fit all in the hair loss industry, and we literally make these products fresh every month and we ship it out. Are there any prescription strength shampoos and conditioner? There is a prescription strength shampoo. It's called ketoconazole. Uh, I don't think you're able to buy it right now on our website, but you should be able to purchase it soon. Please send us an email with your name to help at Happyhead and say that I want to be on a wait list for the prescription shampoo. And when it becomes available, basically you're able to purchase it. It's basically the ketoconazole 2%. The 1% is available over the counter, but the 2% is not available over the counter and it requires a prescription. And we'll be more than happy to write a prescription for you. Thank you so much for that question. How long can I go without applying the product and not to lose the results? That's a very good question. In reality, nobody really knows, but maybe about 3 months. If you don't use it beyond 3 months, you're probably going to start to lose some of the effects from the product. Hi, doctor. Are there any long term side effects of using hydrocortisone? I know typically there's a limit of time on topical steroids. So, first of all, that's a very good question. Yes, there is. And a lot of the similar products out there, they use a very potent topical steroid. And we don't do that actually. We use it over the counter, basically topical steroid hydrocortisone 1%. But look, if you do feel uncomfortable, we'd be more than happy to take the hydrocortisone out for you. The biggest issue is basically on the face. You don't want to use a hydrocortisone continuously at the face because of the risk of, it could thin out the skin. On the scalp, I mean, it's practically almost impossible to do that with this strength of cortisone. So this is why we always recommend not to use Happy Head on your face. I mean, I know some patients could have some beard issues or some eyebrow issues. We do not recommend using the current formulation of Happy Head. We are coming out with a new version that does not have hydrocortisone, and those you would certainly welcome to use it on your face, but not this one. Thank you so much for that question. What causes hair thinning? I love questions like this because I think it's all about education. So there are many reasons why people thin out. The most important one is basically because in our body we have testosterone, and our scalp, the testosterone is converted to what's called dihydrotestosterone, what we known as DHT, in the scalp, and DHT binds to hair follicles, and as a result, that causes what we call miniaturization of the hair follicles. So that's one of the main reasons why people lose hair. But there are also other reasons. So, for example, stress basically will always accelerate your underlying predisposition to hair loss. So stress will make it worse. Your diet also has a lot to do with it. So, for example, if you smoke a lot, the nicotine causes vasoconstriction of blood vessels. By preventing blood flow to get to your scalp, it reduces the oxygen level in your scalp, and that actually creates environment for more DHT production. For example, too much alcohol could also deprive you of certain vitamins that you need that are essential basically for your hair growth. Lacking vitamin D or iron, or lacking collagen, or not taking enough, like a lot of protein in your diet, that will also negatively impact basically your hair. If you take too much whey protein isolate, that's going to increase your testosterone level. Having too much soy milk, energy drinks, DHEA, or other anabolic steroids can also increase your testosterone level and basically negatively impact your hair. So again, there are a lot of reasons. So that's when we look at hair loss. Is basically you kind of have to look at from more of a holistic approach as well. So, and when you sign up, we always send you a list of other stuff that you should do. So, for example, see when you do topical finasteride, in our Happy Head formula, there's finasteride and there's minoxidil. So we're trying to basically head the hair loss from two different point of views. But also, we do recommend basically taking more vitamin D and taking more vitamins and increasing your protein uptake and also derma rolling, because all of those basically will increase basically the efficacy of the topical that you're doing. Thank you so much for that question. If I apply the product once a day, can I increase the dosage? That's a good question. Some patients do, instead of doing 1 ml, you could do 1.5 ml, as long as it's not causing irritation. Also, I've had irritation from the retinoic and the hydrocortisone. I have to take them out. Is there any way to make the finasteride more effective, like the retinoic acid is supposed to do? That's a good question. Well, what we could do, we could add a retinoic acid at a lower concentration to the regimen to make it more effective, and also using derma rollers or derma pens, basically along with Happy Head, will increase the efficacy of the product. So by that, what I mean, basically apply the topical Happy Head on your scalp and gently derma roll, and that's gonna create puncture holes in your scalp and allow the product to go in deeper and better. So you're gonna have better results. Can I apply Happy Head topically only at night before bed and have results? Yes. Look, ideally, we want patients to do it twice a day. But if some patients still do it once a day and they still they see good results. For better results, do it twice a day. But if you need to do it once a day, that's all you could do, that's fine as well. Again, I think I answered this question already. If I applied once a day, can I increase the dosage? The answer is yes. You could go from 1 ml to 1.5 ml, as long as you're not having any side effects or irritation from the product. Thank you so much for asking that question. Again, a couple of things about Happy Head. Remember, it's a customizable formula. It's typically done twice a day. It's a prescription grade finasteride mixed with minoxidil and retinoic acid. If you have any allergies or sensitivities or intolerances, please let us know and we will customize the formula. I got a call this morning with a patient saying that he filled out the questionnaire, but he didn't feel the product was really customized. And I said, look, it really depends upon your answers to that questions. If you were to write in the allergy section that you have allergic to retinoic acid, we will certainly remove that for you. If you also wrote that minoxidil causes a lot of irritation, we'll change the concentration, either reduce it or remove that for you. So really, it depends on patient specific and basically how you answer that questionnaire, that medical questionnaire. But if you basically have no issues when you have the ingredients, then we are going to give you the best products. And what happens is that then we basically see how you do over time. If you're doing well with that product, we'll keep you on it. If you're not doing well, our customer support is going to customize that for you further on, and adjust it just for you so that we personalize it so you have the best product that you could use possible. What happens if I use more than 1 ml to a covered area? Really, nothing happens. I mean, as long as you don't get the side effects of irritation or any other side effects, you're fine to do that. What are the difference between finasteride and dutasteride separately and versus taking them both together? So there's an enzyme that converts testosterone into DHT, what's called dihydrotestosterone. Finasteride inhibits, and there are two enzymes that do that conversion. Finasteride inhibits one enzyme, whereas dutasteride inhibits two enzymes, both of those enzymes. Generally, oral finasteride is FDA approved for hair loss, whereas oral dutasteride is not FDA approved for hair loss. It's an off-label use of an FDA approved medication. So when we started Happy Head, our main formula was finasteride because that's what it was. It was orally FDA approved. So that was the main formula. Years later, we came out with the topical dutasteride formula. Now, finasteride is still our main product used. Dutasteride could be a much better product just because it inhibits two enzymes. And you could certainly get on our website and order the topical dutasteride, or you could email support and we could switch it over. Um, Typically, we use them each separately. However, in cases where we feel that you're not getting the best results from using one or the other, we might go ahead and combine it together and see if basically the combination of the two will work better for you. What is the white substance I see that gets built up at the rim of the bottle? The white substance is actually a combination of the minoxidil and retinoic acid. That's what it is. I'm 3 months, I'm 3.5 months into using Happy Head, and I see some growth on the hairline. That's great. It's hard to tell if I have growth on the crown. Is it possible for growth to be at the hairline first, or does it depend? Well, honestly, it really depends. And what it really depends on, it depends how much peach fuzz hair you have and how much hair follicles basically you have there. So I mean, it's possible that you don't have much hair on the crown at all. You have more in the front. That's where you're seeing more hair growth in the front. Remember, for a happy head to work, you need to have basically hair that already there that's miniaturized. That's how happy head works. And what happy head does is that it reverses that miniaturization and thickens the hair. If you are bald and there's no hair in the crown, happy head is just not going to work. And again, if there's any questions, you could certainly feel free to send us an email, and I will be more than happy to basically evaluate your hair loss situation and let you know if you're a candidate or not. How will habit affect estrogen and testosterone levels? So there are, this is a very good question actually. Um, in the pharmacokinetic studies done on topical finasteride, um, Happy Head did not show to affect overall testosterone levels. Whereas the oral finasteride could affect overall testosterone level, and this is where it could be the difference between who's going to have the sexual side effects and who's not going to have the sexual side effects. Happy Head did affect the serum DHT level, dihydrotestosterone level. So remember, testosterone gets converted to DHT on the scalp. So Happy Head affected the DHT level, but total testosterone level basically did not get affected. Estrogen levels were not tested. And these pharmacokinetic studies are actually listed on our website. There were two of them performed by separate doctors, separate basically industry, and you could see them on our website. Have you ever thought of developing a hair moisturizer? Yes, we have. Um, and we are in the works of basically developing like a hair serum moisturizer. Is in the works. But if the cases that we recommend that is basically in situation where patients are having like a lot of irritation, and I know there is a serum that sometimes we do recommend, and if that's the case, you can reach out to us and I will let you know what we do recommend. Thank you so much for that. I've been using the product now for almost 8 months and I'm seeing minimal improvements. Baby hairs kind of growth. Can I expect over a longer duration of time for this to continue, or is the 6 months mark about as good as it's gonna get? So everyone's different. 6 months is kind of like our milestone. But look, I've had patients where they used it for about 9 to 12 months. They even got better results at that 9th and 12th month mark compared to 6 months. Remember, everyone's different, and it really depends on which level of thinning and miniaturizations you're at. If your hairs have really miniaturized a lot, then really nothing is really going to help. Topical, oral, dermal rollers, laser hats, PRP stem cells, none of those are going to help. And sometimes transplant is the way to go. If you're in that middle of the road miniaturization where you can kind of see the scalp, but the hair is thinning, then this is where basically happy, or I mean, honestly, any medications from Nutrafol, or oral finasteride, Avodart, stem cells, PRP, then that's when it's really going to help the best. So it really depends on where you are in the hair loss process, and this is why it's so important that the earlier you tackle your hair loss, the better results you're gonna get. Because once those hairs are fully miniaturized and dead, there's nothing that's gonna bring them back. Thank you so much for that question. Does this work for ex-cancer patients? Yes, we have patients who have had cancer in the past and used it, and they grew out a lot of hair. I personally have those patients, so it could work. Again, remember, results varies, so you're not gonna know until you try it. If I need a PSA test, will I have to stop Happy Ed, and for how long? No, you don't have to stop. No, you don't have to stop the Happy Ed product. All you need to do is tell your doctor that you are using a finasteride product, and your doctor will be able to basically adjust for that in your test results. Can I blow dry my hair after using the product in the morning? Yes. Just make sure that the product dries out a little bit. The product is alcohol based, so you don't want to spark any fires, which is very rare, unusual. But eons ago, about 10 years ago, there was a case where a patient was using an over-the-counter Rogaine, and he did something and set his hair on fire. But it's been reported, so just make sure the product dries first. What if I'm allergic or sensitive to propylene glycol? I mean, unfortunately, the product is made in propylene glycol. As of right now, we cannot get away with that. I know we are coming out with an alcohol, a water-based formula, but even the water-based formula still has some alcohol in it. It's just the fact that the alcohol concentration is much diminished. So as of right now, unfortunately, we don't have an answer for that. Sorry about that, but we're working on it. How long should the product dry before going to bed? Really doesn't matter. I mean, you could put it on and going to bed. I mean, it doesn't really matter. You could put on a wet scalp, dry scalp. None of those really matters. Again, there was a question about, like, I'm a 35-year-old male, I have male pattern baldness. Am I too old to benefit from this product? Again, the best thing is to really, if you're not sure, sending a photo. If you're bald, the product is not gonna help. I mean, that means if you have no hair on the scalp. But if you are thinning, the product is gonna help, and that's true, honestly, with any hair care product out there. Well, guys, thank you so much for joining me another AMA session. Today I'm actually away from the office. So thank you so much for Evelyn, who's in the office, who's basically coordinating everything, and also Eric, our VP of operations, who's currently in New York right now, doing some pharmacy visits. I'll answer this last question. Um, I think the invite for the discussion included some topic about something about thickening conditioner. I missed the information. Is Happy developing this product? Yes. So Happy, so we are developing, or actually we have developed our own specific hair thickening shampoo and conditioner. The way that we developed the product was by kind of comparing all the products that were out there and seeing what is best for each one, and getting each one of those ingredients and putting it all into one. So our Happy product has everything that's good out there: biotin, keratin, saw palmetto, argan oil, and the product feels really good. Unfortunately, I'm not in the office right now, so I cannot demonstrate it. And typically, what we recommend, basically using shampoo every day, applying it for the scalp for a minute or two, and then washing it off, and then using the conditioner on top of it. Again, putting on the scalp and then basically rinsing it off. It's going to be available in June. What is your advice about being around a pregnant woman with this product or trying to conceive? So the product specifically says, do not use this product if your partner is planning to get pregnant, is pregnant, or breastfeeding. So if you guys are trying to conceive, do not use this product, because finasteride is a category X, and females that are pregnant with should not come in contact with topical finasteride. So if you're pregnant, don't use it. If your partner is pregnant, don't use it. If your partner is breastfeeding, do not use it. And if if you guys are planning to get pregnant, I recommend not using this product. There are other stuff that we could do. There's oral finasteride or oral minoxidil that we could put you on. Does it help with postpartum hair loss? Yes, it could help with postpartum hair loss. But again, if you're breastfeeding, you should not use this product. And my recommendation is that, if you have an infant, just to kind of, wash your hands and really, kind of stay away from the infant, with this product. That's just because we're conservative and we always want to be cautious. Okay, everyone. Again, thank you so much to Evelyn and Eric, VP of Operation. We will see you guys next week at our normally scheduled time around 10 o'clock. Today got pushed back by an hour because we had other meetings. Thank you so much. And if there's any questions, please feel free to reach out at help@happyhead. Also, if you or a friend of you guys basically has hair loss issues and you don't know if you're candidate or not, please feel free to send your photos in, and I'll be more than to evaluate them and let you guys know. Have a beautiful day. Thank you, everyone.